So one question people often have is, what is it like to come in for treatment? And many people are kind of anxious and nervous about it. There are a number of different types of treatment, but the standard type of treatment that exists is what's called cognitive behavioral therapies or talk therapies that exist. And for the most part, those are different types of therapies where you come in and really part of what you need to do is you need to talk to some extent about the details of the event or the events that have occurred. I mean, to some extent, people think that's the last thing in the world that I want to do is to think about those things or talk about them. But the reality is that's what we understand perpetuates the symptoms over time. It's also why people don't come in for care sometimes for months, years, sometimes even decades after they've been exposed to something, because the details of what have happened are so difficult. What we found is that the more you talk about the details, the easier it gets, and the more you can lay some of those things to rest. If you think about nightmares, which is a common symptom, when a nightmare occurs, you don't know whether that's reality or not. It is reality as far as you're concerned. In a counseling session, you can focus on the details of the trauma. You can stop talking about it at any time, and you can kind of press play, fast forward or whatnot. So that's part of what therapy exists of. Normally, it's like an hour-long appointment. Oftentimes, it's done once a week, sometimes twice a week. Usually, about 8 to 10 sessions is the average dose, but that's just average. Some can respond a bit faster than that. Some, it may take longer than that, but that's what most sessions are like. You would come in for like an hour appointment. You would meet with a behavioral health provider, a psychologist, a social worker, counselor, psychiatrist on occasion. That's what most treatments for PTSD look like.